My name is Maisie and my current role is a T-level health student. Currently I'm doing placement in the Radiography department. I first started studying A-levels in biology, chemistry and maths. Throughout the year I found it wasn't for me, I wanted something a bit more practical. So I started doing more research and I found T-level health at Stoke-on-Trent Sixth Form College. What I found about the course is that it was very practical based and we learned a lot of the skills that you'd use in the hospital in the classroom. And that's something I really wanted to do. I restarted the year and did that, and it's been a great experience.
T-levels is a technical qualification that is done by young people post GCSEs for a period of 2 years. And within that time, they can have work experience that is for a period of 315 hours or 45 days over the course of 2 years.
Even when I was doing A-levels, I knew I wanted to do radiography. It's just been my dream. But I knew that I had to gain some work experience, whether or not it was in a different healthcare service, because it's mainly about that patient interaction and team working skills. When I first started the course, we weren't actually allowed to be in the radiography department due to health and safety reasons. I needed a dosimeter, so I asked the college if they were investing in one for me, and they did, and eventually I went into the radiography ward.
So the structure of the placements here is we try and give the students as many different roles as possible. We rotate them through all the modalities. They get a taste of everything that we offer. We try and give them at least 1 day, if not 2 days, wherever they're placed. They'll go through CT, MRI, nuclear medicine, general X-ray.
Start of a typical day, I sign in, I collect my dosimeter, and then I usually go to general X-ray hub. I look at the patients that we've got on appointment on that day. I ask the radiographers, is there anything you need assistance with? It's usually, you can either be wiping down, just preparing the room for patients.
So on a typical day, they'll come in. If there is a team meeting, most of the teams have a meeting first thing in the morning, so they'll be part of that team meeting, which gives them a really good idea of what's going to happen during the day, any issues that they might face, any communication that needs to happen within the department. It gives them a really good idea how the staff cohere and how they work together as well. They'll be expected to take part in the day clinically, so they'll be helping getting patients changed, bringing patients in, helping positioning them for their imaging. They will be listening to the radiographers do the 3-point ID check, information that's required to take a diagnostic image. They'll then be involved in the post-processing of that as well.
My mentor has supported me by placing me in the different modalities on this placement.
We used to have weekly one-to-one meetings, and we just basically go over what happened the last week, what she'd learned, set some aims and objectives for the next week, what else she'd like to get out of the student placement, and overall just making sure she has a positive experience.
So the benefits of mentoring are twofold. They benefit the student, they benefit the staff. It gives the staff an opportunity to tell the student how they're doing and being honest with them. One-to-one meetings are really important in terms of sharing knowledge, building confidence, building trust. The student gets a good idea of where their strengths and weaknesses lie. It also gives the student the chance to identify any areas where their knowledge is lacking so that we can build a plan for them to plug that. It builds really good relationships when there's that mentoring process on board. It builds trust and it builds confidence.
I think radiography is a lot about patient interaction. A lot of people think you're behind the screen, but you're not. You are with the patients a lot of the time. So I think I've worked on my patient interaction very well, my team working skills especially, accurately analysing as well. I think I've learned a lot looking at the images that I've taken, and to be honest, I've been learning a lot on the job.
So the placement opportunities which are for T-level students here, they more or less work similar to what a student radiographer does. They'll encounter patient care skills, they'll acquire patient communication skills, they'll also acquire anatomy skills, positioning skills, and really it's just a beginning and a good head start for them to go into radiography.
I would definitely advise people to study the T-level course. From my experience, even with radiographers and apprentices, a lot of them said they wish that something like that was back in their time when they were at college. I think it's just because we do a lot of academic studying, just like normal A-levels, but there's just the placements, and I think that's what employers are really looking for, is that experience. But in T-level that is part of the course. From my year the minimum amount is 316 hours, so it's definitely using your own initiative.
So if they reach the grades, they've got options. They can either apply to university for an undergraduate diagnostic radiography degree route, in which case they will be at university the majority of the time and come out on placement for so many weeks of the year. Or they can choose to do one of the apprentice routes where they're based in the hospital and they go to university for so many days per year. Again, it's choice, whichever they want to do.
Within Staffordshire Stoke-on-Trent Integrated Care System, we work in partnership with our education providers, but also health and social care partners to provide placement opportunities to young people. And then ultimately, the goal is that when they've got high quality placement provision, that they might choose to stay within our workforce, go ahead to higher apprenticeships, or perhaps go on to further study.
The next steps for me, well, I have currently applied for 5 different universities for radiography. 2 of my choices, my firm and Plan B, have both offered me places, so that is looking really promising. Yeah, that's my next steps.